So what exactly is smog?
So we think that we inhale the air and it is going to affect only the lungs, but that's not the case.
But it also has an impact on the other organs such as your heart, your blood vessels.
Even affect a pregnant mother, can even affect a newborn kid.
Breathing air in Hyderabad is equivalent to smoking 1.4 cigarettes.
The air pollution is a major killer, especially in the developing parts of the world like India and the Asian subcontinent.
I'm sure we are all set to welcome the winters, but are you ready to fight the air pollution? Yes, air pollution has had a significant impact on all our health, leading to development of many diseases. So let's discuss about air pollution and how it's affecting all of us on day-to-day basis. Welcome to the program, Dr. Viswesvaran, and it's good to have you back.
Hi, Dr. Lakshmi. It's always a pleasure to be in your health talk.
So Dr. Viswesvaran, I remember when we started with the health talk session, you were my first guest and we spoke a lot about COVID and other things. So tell us more about your journey and how has it been so far?
Yeah, so it's been almost like 5 years I'm with Yashoda group of hospitals, and we were working even during the time of the COVID at this esteemed institute. So it has been it has been an experience filled with a lot of happiness and a lot of learning for the past 5 years in this esteemed organization. So we had the opportunity to treat hundreds and thousands of patients, especially during the time of COVID, and that experience is something that we will carry with us for the rest of our lives, because even the sickest of patients who were referred to us across the country, who were brought to us by air transfers, who came to us all the way to our organization. Many of these patients where initially they thought that they will never recover, showed very good signs of recovery with the help of advanced instruments like ventilators and ECMOs. And many of these patients who were thought to not make this COVID journey finally ended up recovering, and right now they are back to their day-to-day activities, and they do come for follow-up with so much of gratitude and good wishes for all of us. So it really makes you feel so happy and satisfied seeing all these patients being back to their day-to-day activities. And the biggest lesson that we learned, I think the entire medical fraternity learned from this COVID experience, is that never lose hope and always keep doing your best.
So I'm sure that we've discussed a lot of times about COVID, or be it any infections related to lungs, or be it any other medical conditions. But today we are here to discuss an important topic, which is an invisible killer. So that is how air pollution is affecting all of us. So do you think that's really a threat to all of us, or what is air pollution about?
Yeah, this is a very, very pertaining topic, especially for the current scenario. Somehow, initially, we were all focusing mostly on viral infections, but as you rightly said, the silent killer is still the air pollution. Even if you take the World Health Organization data, it clearly shows that the air pollution is a major killer, especially in the developing parts of the world like India and the Asian subcontinent. And we have had, I personally had a experience when I was getting graduated, when I was doing my DM in Safdarjung Hospital in Delhi. At that time, the air pollution was at its peak. So I can really understand the impact of this air pollution on the health. And we saw a lot of patients coming with the worsening of their underlying lung conditions like an asthma or a COPD. And we are right now seeing a lot of patients who have lung cancers despite not smoking. So which again shows that there is some element of an air pollution which is contributing to this deadly disease as well.
And I'm also sure that air pollution not only affects your lungs majorly, but it also has an impact on the other organs such as your heart, your blood vessels, and also the brain.
When we speak about air pollution, we call it as an air quality index, or the AQI. So anywhere that is between 0 to 50, we call it as a good quality of air, and anything which is above 300 is going to be hazardous for your health. And basically this air quality index is calculated by looking into certain parameters of particles which are present in the air, which we refer to as a PM2.5 and PM10. Yeah. Apart from that, you have certain gases like nitrogen dioxide or sulfur dioxide or carbon monoxide or ozone. So we think that we inhale the air and it is going to affect only the lungs, but that's not the case. Yes, it does affect the lungs by causing worsening of your lung condition like a underlying asthma or what we refer to as a COPD, or it is capable of causing lung cancer. But apart from this, it can also cause a lot of other health related problems, like it can cause cardiovascular morbidities, which means that it can affect your heart, it can make you more prone to develop heart attacks. And there are enough studies to suggest that people who live in areas with poor air quality tend to have higher incidence of the cardiovascular mortalities. Apart from this air pollution, as I said to you before, can even affect a pregnant mother, can even affect a newborn kid. And studies even done on Indian population have said that children who grow up in areas where there is poor air quality tend to have lung functions which are pretty much less in comparison to a kid who is growing in a city where the air quality index is good. So I think it is more of a social responsibility. It is something which the government needs to look into it with much more detail. And I think doctors, we are also trying to do our bit by creating awareness, but I think the society has to come as a whole to address this air pollution.
Absolutely. So talking about air pollution, Dr. Viswesvaran, why is it that we only discuss about air pollution during the winter seasons, or there's a terminology which is called as smog. So what exactly is smog?
This awareness is again because we see a lot of these air pollution, especially in the northern parts of the country during the winter. For example, if you see Delhi during the times of the winter, you can find that the air quality index goes pretty low. It goes to the hazardous range, and the government has to step in. They have to bring the odd even scheme for the cars to bring down the vehicular pollution. They have to stop the construction. They have to stop schools and all these things. This especially happens during the time of the winter. So there are multiple reasons to it. For example, increase in the construction activities contributes to a significant amount of this particulate matter. Apart from that, the air tends to become denser during the time of the winters, so that the pollutants try to stay more in the air in comparison to the other parts of the year. That is one hypothesis. And apart from that, stubble burning. So especially, for example, in the nearby cities, when they have the harvesting season, they need to burn these stubbles from the previous crop, and this contributes significantly to the air pollution. And one another major reason is like even your geographical location. For example, there are certain air currents which tend to circle around a particular city, so that the concentration of the pollutants in this part becomes much higher. Apart from that, even using your a lot of air conditioning systems, especially that generally occurs in the summer, but still these can also contribute to some sort of a global warming, and even ozone which is present can also increase your risk of getting exposed to the air pollutant.
So talking about Hyderabad, Dr. Viswesvaran, there was recent headlines in the news stating that breathing air in Hyderabad is equivalent to smoking 1.4 cigarettes. So what are your thoughts on this?
So these are the analogies that are actually given to make the public to get sensitized, like how serious the air pollution is. As I said to you before, yes, it's a serious problem, but how do we make people aware about it? So we need to use some analogies to say that
how to make them understand.
Yeah, so we use these analogies to make them understand this is going to be the impact that you are going to have by inhaling this air quality, poor air with a poor air quality index. So if you see Hyderabad, as on date, as we are speaking, we have an AQI of around 100 to 150, which essentially means we are still having a poor air quality index. So we are still getting exposed to the hazards of the air pollution. But the fortunate thing is, at least in Hyderabad, I feel like at a personal level, I feel that the air quality index is still tolerable. Whereas when you move to the northern parts of the country, as you rightly said, especially with the smog, you tend to have AQIs hitting as high as 200 and 300, which is extremely hazardous for the health of any individual, however protective you are in using air purifiers and other things. If we as a society take adequate measures like increasing the green cover of the city and decreasing the vehicular pollution by using mass modes of transportation, as well as limiting the construction activities or taking safety precautions for reducing the air pollution while having a
We
construction
can make it a
activity
better
going on
place. Yeah.
can really go a big way in making Hyderabad a city with a more healthy air quality index.
So, apart from how we all can come together as a society, what can individuals take some precautionary measures, or how can they prevent themselves from falling sick?
Yeah. So I think, as I said to you before, the social responsibility starts with an individual. So certain things that can be easily adopted, like let's say that if you are living in the same community and you have to go to a particular school or a college or a workplace, I think using a mass modes of transportation
would be
might
helpful.
be beneficial. Having said that, especially with the winters coming and the viral infections might be on the rise, you need to take certain precautions like wearing a mask and using your hand sanitizers.
Any
and
mask
maintaining.
would be helpful, or are there?
Yeah, for a general public, I feel like even a cloth mask or a mask, a routine mask should be ideal. But let's say that you are a patient who has got a very low immunity because of diabetes or taking steroids, or you're a cancer patient, even an N95 mask can be used in such patients. And especially in the people from a low socioeconomic status, trying to avoid these burning of wood or burning of kerosene or burning of certain fossil fuels for cooking can significantly bring down the incidence of indoor air pollution, because that is something which is less addressed about. And even getting vaccinated is something, irrespective whether it is an infective or a non-infective cause of worsening of your lung condition, will play an important role in getting you protected. And as I said to you before, especially when you find that you have a poor air quality index, then trying to avoid outdoor activities can also help you to reduce your exposure to the air pollution. And even there is not much of evidence, but in areas where the air pollution is pretty high, even people have tried using the air purifiers, but scientifically we don't have much of data to suggest that the air purifiers would really make a lot of difference.
We also have certain bars, especially in Delhi, which are serving purified oxygen.
So this is something which is pretty controversial. There is, if you go by the scientific data, it doesn't make, we don't have enough data to say that such modalities really make a difference in the long run.
So thank you, Dr. Viswesvaran. It was wonderful having you here on our episode today. So before we wrap this episode, what message you would like to share with our viewers out there?
Yeah, so as you heard over this conversation, air pollution is indeed a silent killer, and you can protect yourself and your loved ones from the hazard effects of this air pollution by taking simple steps like avoiding intense physical activity during the time of poor air quality index, and getting yourself vaccinated, wearing a mask, trying to avoid excessive vehicular pollution by adopting e-vehicles or even taking mass modes of transportation. So I think it is pretty much a doable thing, and let's strive to breathe a healthy air in Hyderabad.
So this brings us to the end of this episode. Hope this episode was informative on the topic air pollution and how it affects our health. And we are glad that you joined our episode, and we hope that you learned something new to make yourself healthier and make this world a better place. And don't forget to join us for next week as well. Until then, take care and stay healthy. Thank you.